to slog.
Looks like we're about 4.5 out.
People in the waiting room.
Cool.
So let's just. Can you see the landing page right now? Like the image? Yeah?
Yes.
Okay. And you can only see the image, correct? It's like nothing else?
Yep.
Okay, perfect. Thank you. Okay, so it's 12 and we have 23 people in the waiting room. Can I go ahead and let them in?
Yes, please.
Oh, now it's going up that.
Hello, I'm Melissa Platt, Executive Director for Mental Health Association of San Mateo County. I'm extremely pleased to introduce our host and our speaker for today for the second of our Storytellers education series on addiction, depression, and bipolar disorder. Our host for these events is Angie Coiro, longtime and well-known Bay Area radio personality, host, and event producer for Kepler's Literary Foundation and freelance interviewer. Today, Angie will be in conversation with Dr. Cassandra Joubert, retired professor of public health at Cal State University, Fresno, whose career included work in the philanthropic sector in Michigan, Oklahoma, and most recently, she established the Maya Fund, a donor-advised Silicon Valley Community Foundation program supporting children's mental health. Dr. Joubert is also the author of Losing Control, Loving a Black Child with Bipolar Disorder, and has extensive experience working in the public health arena. Please welcome Angie Coiro and Dr. Cassandra Joubert.
It's such a pleasure to be here, Dr. Joubert. Welcome.
Thank you. Good to see you.
I am going to start out with something within the book, but first I think it's important to check in on Maya, because your book is centered on your daughter. It's centered on the difficulty of raising a daughter where everyone has the problem when they're pre-adolescent, when they're figuring out the world. Raising a child is not easy. You had the additional complication of not knowing what was wrong with your child. And by the time we get to the end of the book, she has a diagnosis. You're still coping. You're still having to deal. How is she today?
She's doing great. She's almost 35. And she is a mom, a very attentive, loving mom. She has her own career. She's gone back to school. She's really doing well. And I'm not sure we talked about this before, but her bipolar diagnosis actually has shifted away from bipolar, and it changes. She's had probably 8 different diagnoses over the course of her life. And I have some thoughts about that, but I'm not a mental health clinician. So I would only be speaking from my own observation as her mom, but she's doing well. She's doing really well. She's on minimal medication, and just, I'm very proud of how she's come along. Yeah. Thanks for asking.
Not at all. In fact, I want to stick with that, because as a mom, and anyone who's watching this who might be going through the same thing as a parent or a supporter, what do you think about all of those diagnoses? And tell me about that experience going through that and where it's left you.
So it started probably when she was 6 years old or so, when we took her in for evaluation with a developmental psychologist. And the psychologist said, well, she doesn't meet all the criteria for ADHD, but she does meet some. So why don't we start her on Ritalin? Now, mind you, this was again 30 years ago. Start her on Ritalin and see how she does. Well, it actually really helped her quite a bit. And we thought, okay, we've got this solved. That's the issue. The story ends there. However, when she hit puberty, about 3 years, because early menstruation, hit puberty around 10, things went haywire and the Ritalin no longer was enough. And she had a diagnosis of impulse control disorder. She had a diagnosis of OCD and OD, oppositional defiant disorder, and obsessive compulsive disorder. And one psychiatrist at that point said, well, we could try her on a mood stabilizer, but the psychiatrist wasn't very sort of committed to that. She was just sort of, well, if you want us to try her on a mood stabilizer, we can, kind of thing. So we didn't. But then they put her on an antidepressant. So she was on Zoloft for a while. And things just, and another medication that I can't remember off the top of my head, but real Concerta, I think it was, really created more problems. Okay. So then we're in a quandary because she's on some medications that seem to be working and some that don't. The menstrual cycle is factoring in. So then that struggle was around age 12. And then finally, when she was almost 16, she was hospitalized. And at that point, they gave her a diagnosis of atypical bipolar disorder.
Mm-hmm.
And because she really didn't have the usual, identifiable highs and, solid lows, she was just kind of mixed up and down all over the place. But they started her on the mood stabilizer then, which was Depakote. And she was on Depakote for many years, and Depakote really helped her.
Mm-hmm.
And then she still was having trouble like with concentration and focus. And she started, trying out various substances. And so the doctor said, well, we don't think we're quite there yet. We still haven't got this completely figured out. So another medication was introduced. And by now she's just graduated probably from high school and going into an associate's degree program in Michigan. And she, again, had a number of outbursts and just real challenges. So the psychiatrist at that time, so this is by now probably the third psychiatrist, she was board certified in endocrinology and psychiatry. So she really understood all the hormonal ups and downs that came along with the menstrual period. So she gave Maya she put her on a cocktail of 3 or 4 medications, which was a lot, but overall she did better. And then she was on those meds really until we moved to California. And Maya decided after, and we can talk more about this, after some runs with the criminal justice system, she decided that she didn't want to be on meds anymore. And she talked to psychiatrist number 4 now. We're in California. And that psychiatrist said, okay, if you want to try to see how you do without meds, let's give it a go. And that psychiatrist thought she had borderline personality disorder. Okay. Now we're at diagnosis number 6, probably. And so she took Maya off of meds. She was in an anger management program that was mandated by the court because of her involvement with the criminal justice system. Maya started to get better and better. And now she's only on Adderall. At age 35, she's only on Adderall and doing well. So that's a long answer to a short question, but that's pretty much what the journey has been.
Well, I'm really struck by the fact that as you were talking, I was thinking about the early storytellers that we've had here in our series. And those are all available online on the MHA SMU website. SMC website, to look at those earlier ones, most of which had to do with schizophrenia. And it's the same consistent story in
Really?
that you're dealing with a child. Children are unpredictable to begin with. You're moving from professional to professional. It's even hard to tell whether there's an issue of competence going on or just the very nature of diagnosis, which even at its best can be all over the place.
That's right. And I think part of it, Angie, was that the first major book on bipolar disorder came out when Maya was maybe 10, right? And I think the field, the field of psychiatry was really struggling with, what is bipolar in children? There was some big debate about whether or not really children could be bipolar. And, if you go back to those early days, you'll see very few resources on bipolar in children.
Mm-hmm.
And so I think even today, the definition of diagnosis of bipolar has changed over time. Now they're viewing it more as a spectrum disorder, right? So that it's not an either or, but you can be on a spectrum, right? And have it just like autism. And I think, I feel for the most part, most of the mental health professionals that we had were very competent. I think they were just trying to get a handle on this at that time, like everybody else. And they brought their own perspectives. Some were more inclined to believe that this was more of a developmental challenge that Maya might eventually just sort of outgrow. I had many people who said it was my parenting. I didn't set enough boundaries for her. And I failed to mention the other diagnosis she had at one time, which was reactive attachment disorder. And I'm thinking, well, that's an interesting one. Here I am, doing so much, being an advocate for this child, 24/7, even at one point quit my job so that I could just focus on her full time. And, they're still questioning whether or not Maya and I have healthy attachment. So it was just, it's been a sad, heartbreaking, difficult experience overall, both with the system of care and just as a single parent, because I divorced Maya's father when she was about 12, and he sort of was no longer available to help. And so it's been the journey.
We're going to break so much of that down. There's so much in what you just said. I do want to let people know if you have questions as we go along, you can put them in the chat window. In the chat window right now is the website for the Mental Health Association of San Mateo County. You can click on that and go to the Storytellers series, and you can find all of those earlier stories that we had. So in the chat window, put your questions and we'll get to as many of those as we can as we go along. One important element we have to get to before we break Maya's personal situation down is that the title of your book, of course, is Losing Control, Loving a Black Child with Bipolar Disorder, which is a whole different animal. And part of your book is actually written by two mental and medical health providers. And in the very first breakdown, talking about how you portrayed it in the book, Dr. Ian Hutchinson says, Cassandra echoes the voice of every parent who has a child who is somehow different. There may be countless reasons for the behaviors and attitudes that seem unusual, difficult, sometimes bizarre. The idea that a child has a mental disorder often brings the most fear, shame, and despair, particularly in the African-American community, where the heritage of strength is expected to solve all problems. Over time, this courageous mother discovered her daughter has an illness that is far more prevalent than previously thought. And I want to break that down. I want to talk about heritage first, heritage of strength, and then we'll talk about the prevalence and why it's different if you're not a white person going through this. The heritage of strength introduced me to two new concepts. Is the heritage of strength for a man, which is called John Henryism,
Right.
The strength of that loud, angry Black woman that we've seen on TV all our lives, the sapphire woman, which I'm not familiar. Can you explain both of those and tie in for us why that could make a difference in trying to get treatment for something like this?
So I think it's really multi-layered. Okay, let me just say that while I think Dr. Hutchinson is correct that this attitude that you must be strong and bear all was operating, I think the other part though that was operating is that just the stigma against mental illness in general, and as much as the just lack of conversation, which is tied to the stigma. People often didn't seek care for mental illness. People didn't seek care for a lot of things. I think you probably also saw in the book that when I was attacked by white boys as a 9-year-old, I wasn't taken to the hospital because
a bleach attack and you weren't taken to the hospital, your eyes.
Right. Because hospitals were segregated. You know, I was growing up in Houston, Texas, in the segregated South. Hospitals were segregated. You pretty much felt confident that you weren't going to get good care. And by the way, even outside of the South, I continue to experience that many times, that my experience as a Black woman was really minimized. You know, I didn't feel heard. Just like the social worker in Michigan, who when I took Maya in, when she had sort of a psychotic kind of break, the social worker said, well, do you discipline her? Do you really, and I'm just going, wow, my experience and what I am sharing is totally being ignored as invalidated.
Mm-hmm.
And so that having that kind of response given to you when you approach systems led to folks not seeking care, right? But I think also there was just, the education, lack of access to quality education around things like mental illness was also an issue, because a lot of the behaviors that we see in folks who are struggling with mental illness, we in my community just sort of said, that person's so crazy, but it wasn't that person needs help.
Mm-hmm.
That person is having a mental health challenge. It was just that person is crazy. So, it's so layered upon, what system of care responses are you getting? What do you actually know about what's normative behavior versus abnormal behavior, right?
Mm-hmm.
And what's your willingness to get it figured out? Willingness and ability through access to care, healthcare insurance, pushing away the stigma. What's your ability to really fight for and answer and get this fixed? So I hope that kind of addresses just in the Black community. And the other thing that was really, I think this is probably the one thing I want to talk about that's almost quote unquote trumps all the others. And that is authoritative parenting. So in my community, and it's funny, I just spoke with a gentleman within the last couple of weeks who was African American, who was sharing with me that he also had this view. He's of my generation. He's in his 60s. He has a child now who is really struggling with some mental health issues. And he said to me, when I was growing up, my mom said, look, you better get your act together and go sit down somewhere. It was like this hard line. It wasn't this, let me try to figure out what's going on. It was just like this hard line about certain behaviors, right? Particularly behaviors that indicated lack of respect for authority or defiance or, talking back or lack of impulse control. All of those things were just so not tolerated in my community. And the idea was that, if you come down hard enough on a kid, they'll change. Well, what I learned, as you read, Angie, what I learned, over the course of the first 20 years of her life, that no discipline at all made any difference. And yet she had a desire. What I was able to pick up with Maya was that she had a desire to do better, but she really couldn't do better. There was something driving this behavior that was beyond her control.
Yeah.
And when that light bulb went on for me, I thought, she's not a bad child and she's not being defiant. She really lacks the capacity to put the brakes on when she needs to put the brakes on. So the response that I got from my family was completely unsupportive. Completely, you should put her out. I mean, many of them just said, you should just put her out.
Tough love,
let her see the consequences of her behavior, which at a certain developmental point, like by the time she was 20 to 22, I did start to let her, live with some of the consequences of her behavior. But up until that time, she's still a child. She's still figuring out, how to make it in the world. And I wasn't going to just let her go to the wolves,
Yeah. I want to break down something you said in there because I think it's important. When you found your family unsupportive, there was what you saw at the time and what you came to appreciate. Your brother just kind of didn't get it. Your brother was like, just slap the kid or whatever, toughen up. Your sister drew some boundaries about what was good for her family. And at the time you were like, why can't I send her to stay with my sister? Why is my sister not there for me? And for anyone who's in a supportive situation, who's watching us, I think that's an important lesson, that what might look to you in your struggle as being unsupportive, that your friends and family do have their own priorities.
Yep. That's right. That's right. Of course, I was so desperate at the time, to get some help that I really could not see that. Why aren't they wanting to help? I really could not recognize the boundaries that they were setting, because I was on the edge of just collapsing, literally.
Yeah. Yeah. Well, two of the things that Maya did that showed how bad it was going to be, she would arm herself, she'd have a blade in her hand. She punched you in the nose. So she was in fact violent. And she also acted out sexually. You went through a heartbreaking incident with her where you had left the house and your neighbor tells you, hey, there were two boys going in and out of that house. That to me, there's just this bottoming out in what you experienced at that point.
Yeah, it was so hard. And I think I have to say that there was also, I had a lot of shame, having been educated, if you will, having gone through a doctoral program in maternal and child health, having studied developmental psychology on the undergrad level and child development. I felt incompetent. I felt like I should know what to do and I should be able to rein this in. And I didn't. Nothing that I tried really worked. So there was a lot of shame. I had a lot of shame. And I didn't let it stop me. I was like, this is embarrassing and all that, but I got to get this kid help. I happened to have a cousin who had a similar upbringing. Well, not a similar experience. I don't know that she was ever diagnosed, but she certainly had a similar sort of trajectory in terms of behavior. And she ended up dying very young. She ended up being on the streets for many years. And having had that experience, I was just really committed to that not happening to my daughter, no matter what.
That you did show strength, as embarrassed as you were, the times that your parenting was questioned. You referred a little bit earlier to someone saying, well, are you disciplining her? And you do have the core and the strength to say, how dare you question me as a parent?
right?
So at least you had that level of confidence to say, look, I'm doing what I can. You are not being helpful.
Right, right. Because again, there was just not this knowledge about mental illness, right? There was just not this awareness that there was this attitude that if people act out, it's because they're making a choice to act out. And while that is true for some of us, that's true for people who are mentally healthy. Yes, if I decide, Angie, I'm gonna manage my conflict with you by punching you in the nose. If I decide that, that's clearly a choice that I'm making, knowing completely what's right and wrong. But for a person who has an impulse control problem or a rage problem, something that's biochemical may be going on, it's not so much a choice. One of the things that Maya experienced was this hypersensitivity to touch. And she was in the line one day at Starbucks to get a coffee. And a woman was behind her, and I'm not sure what the woman said, but let's just say she said, "Oh, Maya, your braids are really pretty," and she touched Maya, and Maya lost it. I mean, she all but, punched the lady. And, that's not a normal reaction to someone saying, or even someone putting their hand on your shoulder, that's just not a normal reaction. So,
How old was she when that happened?
She was probably 20, 21.
Okay. So at an age when most people would have that together.
Exactly.
Yeah.
And even when we had the situation when she was in the criminal justice system because of an assault charge, I asked her, I said, "Well, Maya, don't you know that what you did was wrong? I mean, a friend of hers had done something that violated her, and it was not good. She had used Maya's credit card. So it wasn't anything that was a physical violation or anything like that, but she had taken Maya's credit card and used it and didn't tell her. And Maya was so angry that she went to her home and punched her, basically. And I said to her, "Don't you know that is not the way to handle conflict?" And her response was, she deserved it. So I thought, no, I know that, in my family, we don't manage conflict that way. So that's not something that she learned at home for sure.
Right.
This is something that, with her view of the world, and how, and the way she manages what she perceives to be assaults on her, it's not, it's not within the social norms. I'll just say, so there's something more here.
So I want to take a pause at where we are in discussing her growth. You get to a position with her. You include some of your journal entries in the book, and you include some lists that you created for her. This is what you need to do. This is how much it's worth. If I need to bribe you, I'll give you $5 to do that. I'll take $10 if you do this. And so where we are now, she's a teenager. She has premenstrual issues. She is violent. She's inappropriately sexual. She doesn't have an accurate diagnosis at this point. You're making those lists of rules. And I think for people watching us today, some of them might be now where you were then. So while you're kind of in this maelstrom of everything going on, what do you wish someone had told you at that point?
Oh, well, this is sort of probably a little bit controversial, but I felt that if I couldn't control her, which goes back to the title of losing control, what I was really alluding to was losing this idea that I could control her and had to control her, just to lose that, just get over that, because you can't, right? What I decided to do was to be an ally with her as best as possible, and to keep her safe at all costs. So what did that mean? When she told me that she wanted her belly button pierced, I knew that I needed to, even though it was against my, better judgment, I knew that I needed to go with her. I needed to find a provider that would do that in a safe and clean place and accompany her to get that done, because she was going to do it. She was very headstrong. It was just a matter of, was it going to be a safe place or was it going to be an unsafe place? So I made the choice that I would go with her. The same when she decided to dance at a nightclub. I decided, okay, my daughter, I think she was maybe 22, 23 at the time, is, you know, engaging in this kind of work that is very unsafe at some very obscure place in the back roads of Fresno, California.
Mm.
And I thought, okay, if she's going to do this, I'm going to drive her there. I'm going to meet all of the bouncers. They're going to know me so that if something happens to her, they know who to call. And I did. That's what I did. When I drove into the parking lot of that institution, I yanked my Fresno State parking sticker down out the window so nobody would recognize me. Like, why are you here? But I was committed to her not being out on the street, and I didn't know where she was.
Mm-hmm.
You know, I couldn't stop her from doing it.
So the wisdom that I'm hearing there, and it's on two levels. One is recognizing who she is, that she is headstrong, that she will do that, and you're going to meet her where she is on that. But the other thing, and correct me if I'm not hearing this correctly, is that she's at an age at that point, 22 or 23, when you might expect more adult decisions, depending on the young person. And I think that that's another case of meeting her where she is. Maybe another 22-year-old would not make that choice, but you're meeting her where she is, regardless of where she, you know, should be in her development.
And that's really key. And that was something that also I think is sort of culturally laden for Americans. You know, I mean, we really think that when a kid hits 18, you know, they're supposed to have it together and leave home and, you know, get a job and make it on their own. Maybe that's gone up to 21 since, you know, in the last few decades, but certainly in my parents' generation, when you hit 18, you were an adult.
Mm.
You're ready to do it, to get it done on your own. And it was so apparent to me that, and this is where the fact that she was of legal age, right? She could do various things because she had hit 21, that developmentally she should not be doing, just because, I mean, whether she was an adult or not, she shouldn't, perhaps, you know, by my standard, shouldn't be doing, but certainly, but developmentally, she was more like a 15 or 16-year-old, right? She was functioning at that level.
Mm-hmm.
So I just had to recognize that, and also recognize that the systems weren't really supporting me, in the sense that she was legal. You know, she would tell me, well, I'm an adult, so I can do whatever I want to do. And she was right. She really could. There was nothing that I could do to keep her, you know, from engaging in various activities. But at the same time, I just had to adjust my expectation of what a 22-year-old like her might be able to handle and not able to handle, and what kind of support she needed. So
Yeah.
I didn't see another answer, quite honestly.
Well, the one you found worked.
You know what, Angie, I think what really worked, and this is really interesting, I think that I had always told her from the time she was in high school that if she wasn't careful, she was going to end up in jail, because she was doing a number of things, whether it was using somebody else's credit card or speeding or using substances. You know, it was going to catch up with her. And I emphasized that to her over and over again. And I kept saying, Maya, I am trying to keep you out of the criminal justice system, quite honestly, because I can't watch you 24/7. And yet you're doing these things that are ultimately going to get you in trouble. Well, she ultimately got in trouble, and She was incarcerated. She was in jail for a short time, for about a week maybe. And when the bail bondsman called, they fully expected, here is this middle-class child, with parents with resources. They fully expected that I was going to cough up the $8,000 to bail her out, and I didn't. I said, no. While she may not be able to control some of what she's doing right now, she really knows that she's going to have to take meds or get some kind of care or do something that will help her. She has to take responsibility. I always told her, your illness is not your fault, but it's your responsibility. And once you get to be an adult, I can't be with you all the time. So you have to be responsible to the extent that you can, with your meds and being careful with your behavior. So after the week or so in jail, she came out, and then she was on some kind of work release program for several months, and she got in trouble on the work release program. So then she went to detention, and she was in a detention facility for 3 months. And when she was there, God bless the other young women that were there, said to her, you kind of don't belong here. In other words, you have family support. We don't have any family support. You have resources. We don't have any resources. So why are you here? And that really, it wasn't all the teaching that I had, tried to drive home for her over the years really didn't land. But to hear that from her peers, just really saying, you have the capacity to do better. You may not be, fully in control of all of your behavior or whatever, but you have a lot of support that you're not taking advantage of.
There's a credibility coming from them that couldn't possibly come from you.
Didn't come from me.
I'm stuck on the idea of a mom whose daughter is in jail for a week. And in retrospect, it's easy and admirable to say, well, I told her, she had to live with the consequences. But I can't imagine what it's like to be a mom. And every night, my daughter's in jail. My daughter's in jail. My daughter's in jail. I can't imagine what that was like for you.
Yeah. And trust me, that was a long time coming, Angie. I mean, I think I had to get to a point where I really could accept that, one, it wasn't my fault what was happening. And two, that I really had no control. I mean, I had done everything that I knew how.
Mm-hmm.
And I just had to bear the pain. It was almost like trying something different, if you will. I had bailed her out, not of jail, but I had often been there to pick up the pieces after, and I'd picked them up and I'd picked them up and I'd picked them up and I'd gotten her back in school, or, gotten her into a treatment program, or gotten her into counseling, or, I've been there. And, I think some of it was just fatigue, quite honestly. Some of it was just, I don't know what else to do.
Mm-hmm.
And I think that while I think she has the cognition to know better. She may not have the impulse control, but I know she knew that this wasn't going to work. And yet she it gets to a point where I started to feel like some of it was a choice. And I think that was just the development of her brain over time that, I think that when she made the decision to go to the girl's house and hurt her, she knew exactly what she was doing.
Mm-hmm. Mm-hmm.
And when she said that she deserved it, I thought, okay, then guess what? You deserve to be incarcerated.
Yeah.
Because she was 6 or 8 or 10.
Okay.
It was over time working to see, okay, what is she capable of and what is she not capable of, and just really keeping an eye on that. And that's when I realized that, yeah, now's the time that some line has to be drawn.
That's another thing that's in common with a lot of the other storytellers we've had. There comes a point where you have to let them launch themselves, because you as a human being have kind of gotten to the end of your resources, and that let's try this. So I do want to invite people, if you have thoughts or questions, to put them in the chat window, and a couple people have. Backing up a little bit, Yamel says that one of the things that gets thrown at you as from a family member or a supportive person is, well, this is a choice. This is a choice you're letting the child make, or you're not close enough to your faith. And that's ironic, considering that your faith is part of what got you through all this. That's
right. Oh, that's so, yeah, that's the other thing is that, I grew up in a community that was very religiously conservative, even though my family was not, but I grew up in that community. And I think that, again, spare the rod, spoil the child was still kind of the way of thinking. Thank goodness my father left that community, that religious community, and joined another one that was, really emphasized more love and compassion and being present and understanding, so I was able to make that shift, and I was glad. I relied on that tremendously. But there's also this element of letting go. There's an element, the losing control piece and the letting go at some point. And I think that's what you're saying, that some of the other families finally got to the point where, okay, we've tried everything. We've given all that we have of our own resources. We've given it. We don't have any more. So we have to let go and let God, let go and let the universe. And that's, to this day, I don't know how I did it, but I just had to do it. I think it was fatigue. It was just like, okay, I don't have a choice. I don't have any other resources to put on the table.
This is from Meg. She says, thank you, Cassandra. This is beautiful. It's so resonant with my own experience as a white mom with a brown daughter. Same story. I'm wondering how much Maya was able to articulate to you and talk with you about her experience at age 12 or age 20 or later. How did that evolve?
She wasn't able to be reflective and aware in her early years. She really wasn't. I would ask her, well, how does this feel? Or how are you experiencing that? And her response would just be, I don't know, I'm confused. I don't know, I'm confused. And I literally could see wheels turning in her head as she was talking to me. She was trying to make sense of, I knew that I maybe shouldn't do this, but I did it. And I mean, she was just very, very hurt. And I don't know how much the medications had to do with that.
Yeah, there's that too.
Right? I don't know if those were medication side effects, but I don't think so. Two other things I want to mention, Angie, is she had a closed head injury when she was 16. And her behavior after that, I won't say really escalated, but it certainly, didn't get any better. And I had to keep thinking, I mean, I was so confused and so overwhelmed. I had to keep thinking, wait a minute, was she behaving this way before the head injury, or did this start after that? I mean, it was just like, there was just so much going on. And, but during that time, she got on Tegretol, which is an anti-seizure medication. And that was a part of her medication regimen. And that really helped her with clarity of thinking. Again, to the system of care, she should have had some rehabilitation.
Mm-hmm.
After that, she had none, which I find interesting. She lost her ability to do math. Her memory went short. Nobody offered or suggested that she should be getting some kind of rehabilitation after that.
Well, and the background, if I may, the background on that story, I think is important because it goes to another thing the parent has to deal with is that when a child is going through all that your daughter was going through, and she has to deal with mean girls at the same, even a healthy kid doesn't want to deal with the mean girls. She didn't have the capacity to make close and intimate friends. So tell me what happened with that head injury.
So she was a cheerleader. She was the flyer, the one that they throw up in the air and catch. And the mean girls decided not to catch her. They didn't like her. She was she had a way of being very intrusive in people's personal space. And they let her fall. The cheerleading coach told me that she felt that they let her fall on purpose. And, so her head hit a linoleum floor, outside a gymnasium at high school. And she was paralyzed for a short amount of time on one side of her face, took her into the ER. They did the CAT scans at that time. They didn't do MRIs to see if she had a bleed, and she didn't. And then they had her come back in a couple of weeks, and she never had a bleed, but she did lose function. So she had a severe concussion, and she did lose some functioning over time with that. And, that was part of her sadness and depression and her mood problems, was that she didn't have any friends. She really didn't have any friends. And, but now she's, it's a different story. I mean, she's learned some things about, personal space, and she's very smart. I think we're fortunate that she didn't have any cognitive or intellectual disabilities that meant that could have meant that she couldn't really learn how to be a friend. But over time, she, interacting with family members, and we would tell her, that's inappropriate. Can you say it this way? Think about this when you approach your friends. We just did a lot of coaching of her on the social cues, which she completely did not get. Over time, she got much better with that. But Angie, there's one thing I want to make sure before our time that was a huge light bulb for me that I want to share. So now I have 3 grandchildren. One of them is her son, but the other 2 are girls, and they're my son's daughters. And when they were young, when the first one was 18 months, I took care of her a lot and took her in for a pediatrician well-child visit. And the pediatrician asked me how much time I spent with my granddaughter. I said, oh yeah, I'm with her 2 days a week. I know her very well. She said, well, since mom isn't here, can you fill out this form? And I said, sure. And it was the MChat, which is, I think, the modified checklist for autism in toddlers or something like that. So it was a screening for autism. So I'm going down this checklist, which, if I recall correctly, had about, 20, 30 questions. And one of them was, is she hypersensitive to sound? Does she engage in joint attention with you? How is she on language? Does she have other sensory sort of differences, like being a picky eater, or not liking to be touched, or not liking to be rocked, or, so there's this long list of things. And for the first time, and this was only Ava, my granddaughter, is now 5. So this was 3.5 years ago. I thought, oh my God, if I was filling this out for Maya as an 18-month-old or 2-year-old, I would be checking all of these as yes.
Yeah.
But none of them for my granddaughter. My granddaughter's perfectly, doesn't have any of those difficulties. But so then I start to think, suppose she's on the autistic spectrum. Suppose this child all along, all of her reaction to stimuli, all of her inability to communicate or read social cues, suppose this all along was high functioning autism. And so I wish I could do it over. I wish, if she was born in 2020, it would be a different story. But I'm absolutely convinced. I mean, she also had, when she was 2 or 3 years old, she filled up an entire page of paper with little tiny circles. And we were thinking, wow, she can't really write her name, doesn't know her alphabet, but she's filling up this whole page, 8.5 by 11 page, with little tiny circles, which is sort of a repetitive behavior that, could be another sign of a developmental challenge, And I just wish we could do it over again, but she's doing great. So I just have to be grateful that we are where we are.
Yeah. Yeah. Well, in fact, let's talk about putting everything in perspective. There are introductions and forwards on your book, which is normal, but your first words in the book are, "I will grieve for my child. Even today, when she greets me with a hug or a kiss, I still feel the pain of all the lost years, all the agony, all the wildness, and all the fear." And then you go into the better part of that she's had a rebirth, that, that is in the past. But I have to ask you about putting that grief in perspective from the time you wrote those words to where you are now. Tell me, is that still the thing? Are you still grieving that time, or does it have a different perspective?
I have a different perspective now, because I honestly didn't think I would ever be where I am right now with her. I was at a friend's house, and he and his daughter, who at the time was maybe 19, they were making challah bread in the kitchen together. And I just burst into tears, because at that time, my daughter was about the same age. And, I said, I'll never have moments like this with my daughter, where we're making bread together or going on a trip together, and it's not true. I am having those times with my daughter. We are going on trips together. We are, doing mom-daughter things together that I thought would never happen. And I have to say that I think my letting go of some of the, hardlining, of I've got a controller, my just saying, I'm here for you. I can't fix all the things that you're doing or change what you're doing or assure a perfect life for you. I can't do any of that, but I will be here and love you regardless. I mean, I think to the extent that I was able to let go a bit, it made space for a relationship with her that supported her development and supported her healing. So I don't feel the sadness that I used to feel. I really feel very grateful that, we are where we are. Mm-hmm. And to any parent that says, okay, what would you suggest in the moment? I would say, take the long view, because development does change over time. And so, I mean, I don't know that this is true for, of course, all illnesses, but in her case, she did continue to get better over time. And my steadiness and being there with her and not giving up on her and not abandoning her really, I think, was critical. And we now that I'm 67, we talk about, well, Mom, and I don't know why, she's very curious about what her life is going to be when I die. Mm. And we have that conversation. She said, but Mom, nobody knows me like you. Nobody loves me like you. Nobody talks to me like you. Nobody's with me like you. And I go, yeah. And the cycle of life is that I will not be here forever. So I am hoping to instill some capacity and self-awareness within you so that when I am gone, you're able to do these things for yourself. You're able to give yourself the strokes, and you're able to talk back to yourself about, oh, this is what my mom would say, if, in this circumstance. So I'm just grateful for being where we are now. Yeah.
I'm going to go back to the chat window. We're getting short on time, so if you have any questions or comments, this is the time to put them in the chat window. Amy says, we were talking earlier about the people who had harsh things to say about you as a parent. She says, Cassandra, no one should criticize you if they haven't walked in your shoes. Thank you for telling us your story. And Linda chimes in, Cassandra, thank you for sharing. I'm an African mother with a 35-year-old daughter on her journey with mental illness and have had similar experiences with my daughter.
Wow.
Which leads me to ask, you have been working in various forms of child support services your whole life, getting care for children and seeing that systems are in place for them. Where are we now in terms of being, and when I say we, I mean as an American society, where are we now in providing the kind of health that kids need across economic structures?
I think we still have a long way to go, especially in the behavioral health arena. I think that in many ways we are very still stuck in a medical model of, let's diagnose and treat. And I think that, for the last 20, 30 years, we've seen that brain development really happens in the context of relationship, right? So the systems of care should be asking, how can we better support relationships, right, between parents and children in the early years? That's the question that we need to be answering. Now we've got organizations like 0 to 3. We've got curricula and programs that deal with infant parent mental health. Those are the things that really need to expand exponentially. We've got ACEs, our awareness of adverse childhood experiences, and our Surgeon General here in California is doing amazing work to make ACEs screening available on the ground. But all of this is within the last 10 years. A lot of the things that I'm alluding to are still fairly new. They need to be expanded exponentially in order to reach everybody. The other challenge, I think, is that some of the professional development for providers is very, it's only available to the elite, if you will. It's only available to clinicians by and large. When the truth is, who's got our kids day in and day out? Parents, family daycare home providers, childcare center providers. They need this information about the importance of relationship because they've got the hands-on. They're in the position to really make the change. So I would hope that those kinds of systems would expand. The other thing is that for so long, there have been these two silos of children with special needs and children with normal development. Well, the truth is, in any classroom or in any family for that matter, you can have a child that's developing typically and a child that has special needs. So how do you meld those two in the same environment so that everybody gets what they need? The integration, the mainstreaming of kids that have problems, not kicking them out of preschool and see you later when you're in the juvenile justice system. How can we help them now in those early years? So that is where I think, and I would say California is probably ahead of the game in some ways with universal preschool and TK, transitional kindergarten, and like I said, the ACEs with the Surgeon General office, but we've got to do more on a national level in that area.
Well, what about that? You had so much assistance, and I think it was the Detroit school where all of a sudden you had a team of 5 people helping your daughter to stay in her classroom. Is that rare? Is that common? I was stunned by that.
Very rare. Very rare. And I'd be curious to know if it's still in place. There's a lot of really great support, that school that she was in Michigan was called a National Blue Ribbon School. And it was the school where the kids were performing at their highest. And in those schools, the attitude of the administration and the teachers was, I don't care who you are, what side of the tracks you come from, what race or ethnicity you are, you're going to succeed. That was the mindset.
Wow.
And I don't know if that's still in place, but I think if every school had that mindset, that no matter what the child brings to the table, we're ready and able to provide the supports they need. If that was in place, I think we'd be just ahead of the game.
Some final comments, and I want to let people know, Losing Control right now, unfortunately, is out of print. However, it is very easy to get a copy. There is a used book consortium online. It's called ABE, like Abe Lincoln, Abe Books. I was able to get a copy on the first page. Very easy.
Wow.
So go to Abe Books, enter Losing Control, Loving a Black Child with Bipolar Disorder, and that will come right up for you. So some parting thoughts from our audience. Thank you for sharing your story. It's similar to my son's story. He's 23. I'm interested in knowing, when was your daughter ready to live on her own? And she adds, I want you to know you have done an amazing job. So some thoughts for her?
Oh, wow. So I definitely let go of the idea that she needed to be on somebody's time schedule, right? She tried living on her own initially when she was in that 20 to 23-year-old age, and it didn't work. That was when she got in trouble and was incarcerated and all that. So I said, okay, come on back home. So she came back home, and then she and her partner decided that they wanted a baby. This was her first long-standing relationship. I said, okay, well, if you're going to have a baby, which I didn't, quote unquote, approve of, but again, she made up her mind she was going to do it. Said, okay, well, you're going to spend your pregnancy here with me, and you're going to spend the first few months of the baby's life here with me, so that I can make sure everybody's healthy and safe and all of that. And then when the baby was 3 months old, so he'll be 2 in a couple of weeks. When he was 3 months old, I said, okay, it's time for you guys to set up your own home, and everybody's breastfeeding and healthy and meeting all the milestones. Time for you to go. And so she just moved. So she was just a little past 30, I guess around 33 when she went out on her own.
Got it. All right. Deborah says, Dr. Joubert, your willingness to share your story is a blessing for mental health professionals and encouragement in particular for those parenting African-American children. And Latrice says, don't we always judge parents? We all get judged when our kids don't act right, but God bless you and your family. I'm a Black woman from Houston in my 50s, and only because my mother was a nurse did our family get the correct medical care.
Wow.
Yeah, that's not the way it's supposed to be. So it's been such a joy to talk to you. Really appreciated it.
Thank you so much for your interest and your questions. And I'll be honest with you, I have not relived this. I probably haven't really talked about this for at least 10 years. I don't know. So it's good to have a good ending.
Right. It is. It's nice. I appreciate that. If anyone came in the midst of this or you missed any part of it, it's going to be put up on the website, so you won't miss that. That is mhasmc.org. So Dr. Joubert, goodbye to you and goodbye to our audience. Thank you.
Thank you so much, everybody. Thank you so much. Bye-bye.
Bye.
Thank you so much, Angie and Dr. Joubert. These are really important conversations, and we're so glad you're willing to have them with us and with all of the people who participated today. I'd also like to thank our sponsors, Beacon Business Bank, Heritage Bank of Commerce, Ginny Stewart, Marilyn David Krasner. We appreciate the support. Thank you all for joining us today, and we hope to see you for our third event with Shonda Buchanan on February 24th. For more information about our organization, please visit our website that Angie just mentioned, so you can stay abreast of our current programs and future events. Thank you so much for joining us.
Bye-bye.